We told our employees, everybody who's facing the patients have to wear N95 masks and the gowns and the gloves and the face shields if they are handling a patient with either suspicious COVID or positive COVID. And we did isolation rooms, and we opened an old office and turned it into a sick clinic. What I can tell you, the camaraderie for these employees and the way that in the maturity and the heroic ways to handle this was just amazing to me and the whole VITF, Viral Illness Task Force. I will give you an example. The sick clinic is handled by an LPN, an MA, and usually an APP on the sick side, and then there is a other side where we give patients treatments or IV infusions if they have neutropenic fever, and we cannot sort out if they might have COVID or not. And so we are trying to still separate them, even in the sick clinic, for COVID ones for sure, and then non-COVID but suspicious ones. The clinic is high risk, therefore, you expect some resentment or some fear to go work there, but there has been nothing but volunteerism and appreciation of the fact that we provided the PPE, and that they are so willing to work and rotate and help this clinic. So to me, this is one of the success stories of the people trying to help each other and being very understanding and taking the risk to take care of these patients. Other stories, I would say, we were the first site in the country to have COVID, so there was a lot of fear, a lot of perception that, oh my gosh, we're all going to die, what's going to happen. So there was a lot of, maybe drama in the beginning, but yet we had very little amount of COVID patients, even though Pierce County, where we practice, is the second highest in the whole state. We had only 3 patients with COVID, and 1 employee that's a non-clinical employee, a young lady who did not even face any patients, and she worked in a very small office, so she didn't face a lot of other people. So there were only 4 people in the whole entire organization, and from the beginning of this with COVID. And I think that it is probably because we, as a state, we took a big precaution and everybody locked down early on. But a part of it is because the procedures that were put in place were pretty solid, and I think that helped us to control the disease, even though in our hospital system there are tons of COVID patients.